So, in continuation to the previous presentation, I'm going to discuss about the superiority of the Panchkarma therapy. Yes, we do have a lot of different ways to combat with these kinds of health issues, but still, Panchkarma Chikitsa is the best answer. Why our Acharyas has given so much emphasis over this particular treatment modality, even it is a bit complicated. So here comes the answers. It has the ability of evacuation. Panchkarma procedures brings the evacuation of the morbid materials or the vitiated doshas out of the body. It has the superiority of the efficacy. In Ayurveda, there is two major forms of treatment. One is Shaman Chikitsa, that is palliative care, and one is Shodhan Chikitsa, that is biopurification measures. And out of the Shaman and Shodhan, Shodhan is more superior than Shaman. It has been written that dosha kadachit kupyanti jitalanghane pachne yetu sanshodhane shuddham na tesham punarudbhava. So what actually happens in Shaman Chikitsa, we pacify the doshas which are vitiated inside the body. So there are chances of reoccurrence of the disease. But in Shodhan Chikitsa, the doshas and the morbid matters are being expelled out of the body. So in a form, it ensures a complete cure. So the Shodhan Chikitsa is have a superiority of efficacy over the Shaman Chikitsa. And Panchkarma Chikitsa mainly comprises of the Shodhan Chikitsa. It has enormity of procedures. Actually, there are many procedures which are being performed either in conjunction or in isolation with the Panchkarma therapy. They are called as Upakrama or allied procedures. And the present era, all these Upakrama are being categorized or referred as the Panchakarma, like Shirodhara, Abhyang. In European nation, when we talk with foreigners, they always say Shirodhara as Panchkarma because these names are very familiar with Panchkarma and now they are being categorized under Panchkarma also. So, in the list of the Panchkarma procedures is enormous. So, we have a lot of number of procedures that can be performed in a single disease. Then it has a targeted dosh eradication. In Ayurveda, there is a concept of dosh pratnik chikitsa, and Panchkarma fulfills that concept. All the procedures of Panchkarma has a capability of removing the morbid material of any kind from the body, but they have more efficacious in relation to certain doshas, like for kapha, vaman karma, for vitiated pitta, virechan karma, and for vitiated vata, vasti chikitsa. So they have a specific biopurification efficacy according to doshas. And last is multiplicity of action. No doubt the major action of the Panchkarma is Shodhan, but it not only performs Shodhan, it can also be administered for palliative purpose, nutritive purpose. It is an essential prerequisite for Rasayan and Bajikran Chikitsa, for Shaman Chikitsa. It has an effects like Shaman, Bringhan, Stambhan. There are Shaman Vastis, Bringhan Vastis. There are Shaman, Bringhan Nash. There is Stambhan Nash, Stambhan Vastis. So overall, these are the reasons that's why Panchkarma is superior among all other treatment modalities. Now, the clinical importance of the Panchkarma. It has immunopotentiation quality. It does biopurification. It helps in disease prevention. It has specific disease cure. It does disease suppression, and it helps in rehabilitation. So there is preventive form of Panchkarma, there is disease curative form of Panchkarma, and there is a rehabilitative form of Panchkarma. So it serves both the purpose of Ayurveda, what I have already discussed, that swastha swasth rakshana, that is maintenance of health of an healthy individual. In terms of swasthvit, apart from Patthapat, Panchkarma is the only treatment modality which helps to counter the disease prior to its manifestation in the form of seasonal Panchkarma. There is a concept of Ayurveda that the doshas get naturally provocated in certain seasons, and these naturally provocated doshas, when expelled out of the body, then they are not able to cause any kind of harm to the body. So, in this regard, it is being proposed that Panchkarma is to be performed in certain specific seasons in which the doshas are being aggravated, like in Vasant Ritu, that is in spring season, the cough is being provocated. So Vaman should be performed to expel that provocated cough out of the body. In Sharad Ritu, that is in autumn season, the pith is being provocated. So the process of virechana should be performed to eradicate this provocated pitta. And in Pravat Ritu, that is in rainy season, the vat is being provocated. So Vastikam is to be performed. When these processes are being performed, then the seasonal disorders cannot occur to that individual. And second is Atras Vikar Prashmanamcha. What I have already discussed, that according to the doshic predominance, the Panchkarma procedures have a specific biopurification efficacy. Like in Vata predominant disorders, the Vasti Chikitsa, the medicated enema can be given. In Pitta predominant disorder, Virechan should be preferred. In Kapha predominant disorders, Vaman should be preferred. And in Raktaj Vikara, Rakta Mokshan should be preferred. So, in this way, in the disease condition, we can choose the Panchkarma according to the condition of the patient and disease. There are many ways of application of Panchkarma therapeutic measures in the body. There are several principles. So I am going to discuss these principles or the ways of the application of Panchkarma. One is Sampurna Shodhan, that is full Panchkarma therapy. All the 5 therapeutic procedures are being applied in a sequential manner. Second is Karmataha Shodhan. In this, application of certain specific selected Panchkarma procedures is being given according to the condition of the patient and disease to get the maximum outcome from that particular disorder. The third is Punha Shodhan. It is a very special kind of application of Panchkarma in this the Panchkarma procedure is applied in a fixed interval of time. As Achar Chakrapani has told in the Kushta Chikitsa, to abolish the Kushta Rog, we have to perform Vaman in every 15 days, Virechan in every 30 days, the Rakt Mokshan in every 6 months, and the Nashin every 3rd day. Nitya Shodhan, the daily administration of Panchkarma procedures, either for a limited period of time or till the disease subsides. There are Pratimarshnash, Yuktrat Vasti, Mridu Virechan, and there are conditions like in Udar Rog it is told Tasmat Nityame Virechate. So Nitya Shodhan can be also be performed. Third is Kalanushar Shodhan, that is seasonal form of Panchkarma, which I have already discussed, that in certain seasons natural provocation of the doshas occur, and via this Kalanushar Shodhan we remove that naturally provocated dosha out of the body. And the last is Sadhya Shodhan, that is a prompt administration of the Panchkarma procedure in the emergency conditions without Purvkarma. The two conditions can occur. Either the doshas are highly aggravated in the fulminant condition of any disease, or the condition of the patient is not permitting to hold the Purvkarma. Like in a case of someone has taken poison, we have to undergo Sadhya Shodhan. Or in any kind of fulminant condition of any disease, we can do Sadhya Shodhan without administering the Purvakarma. So, now I'm going to discuss about the overall effect of the Panchkarma therapy or overall benefit and utility of the Panchkarma therapy. So, Panchkarma can be performed on a seasonal basis. It is an important prerequisite for Shaman Chikitsa and a prerequisite for Rasayan and Vajikaran Chikitsa. Actually, a diseased body can be compared with a soiled cloth, and in a soiled cloth, we cannot color it whatever we desire. We have to first clean it and then we can color it. In the same way, if the channels are having obstruction of any kind, so whatever medicine we will give for the purpose of Rasayan or Vajikaran or for Shaman, it will not reach up to the site where it is desired. So prior to Rasayan Vajikaran or Shaman Chikitsa, if we go for Shodhan Karma, it will result in the cleansing of the channels, and so when we administer the drug will be able to reach to the deeper tissues of the body, it will be assimilated properly, and bioavailability of the drug will be maximum. So we get maximum output and more efficacy from the same drug after Shodhan Chikitsa. It is also palliative and nutritive in nature, which I have already discussed. And after the Panchkarma in the body, a kind of intrinsic upregulation in the body metabolic system occurs, which helps to cure the body by itself in many condition and disease. And it can also be applied as a daily routine in the form of pratimarshnash to eliminate the risk of diseases of head. In the same way, many other kind of Panchkarma procedures can be applied on a daily routine to eliminate the risk of the diseases. So, coming on to the research areas, no doubt we are having a very radical and rational approach which is highly practical and clinically applicable and having a lot of advantages and applicability. But it is also known that at the implementation level, we are not able to emphasize Panchkarma up to its full potential. So there is an urgent need of systematized scientific research in this field. Yes, the global popularity of Panchkarma is increasing day by day, and this growing popularity gives us new challenges to do the scientific research. The research should be done in a way to incorporate the Ayurvedic philosophy and knowledge together with the modern day knowledge and tools, so that this is the era of science and technology, and everything needs to be assessed precisely and perfectly. So there is an urgent need of standardization of Panchkarma procedures in reference of dosage schedule, exact procedures, and medicaments. And in terms of application of classical Panchkarma, some uniformity in the schedule of practice is also required. And there is a need of developing markers and parameters to monitor the rate of tridose specific biopurification during the Panchkarma, so that the specific biopurification efficacy can also be ascertained on a scientific basis. This and much more is needed to establish it as a holistic therapy in the modern era. So, now concluding remarks, Panchkarma is having a multidimensional benefits. It is applicable to all cases, covering a wide range of preventive, health promotive, curative, and rehabilitative care, and it proves itself to be a holistic therapy for the global healthcare. And not only this, it gives us a healthy liver, a happy kidney, a smiling heart, a hungry tummy, a sweet pancreas, last and not the least, a happy and a healthy life. Thank you.